Hi, I'm Kuntal Banerjee, and that side we have Dr.Supravo Chatterjee, and we opened this channel Healthcare Today to discuss about the current issues faced in the healthcare sector by India as well as countries abroad.
Okay.
Today, our topic of discussion will be current healthcare challenges faced by India.
Okay.
So, Supravo, what are the current healthcare challenges faced by
So,
India?
so that is we'll come to that, but let me tell a bit about yourself. You introduced yourself as Kuntal Banerjee. So for the listeners, I'll just like to add that Kuntal here is actually a doctor and he's a practicing doctor. And yeah, so that much about him I'm allowed to tell. So anyways, so there are major healthcare problems we are facing right now. One of the major issues is healthcare spending. Like Kuntal, what do you think about the healthcare spending? I mean, there is a major debate in everywhere about healthcare spending. Is the government spending enough? Is the public spending enough? Who is going to spend for the treatment and everything? So these kinds of things. What's your take?
So we in India we are spending only 4% of our GDP on healthcare. Okay, and that too 1% is being spent by government. Okay, the spending on healthcare is very less in India compared to other BRICS nation. The spending in India is not at subpar with the BRICS nation, and we are spending much lesser than any other nation which is developing. And we should try to increase our GDP first. Okay, and that from that total GDP also we need to spend. That the government need to spend more amount of the GDP on healthcare. Okay.
Okay.
So, what's your take?
So I would say, as we are progressing towards as we're marching towards becoming one of the giant, giant countries. So I think as of now, our GDP is growing enough day by day. So we should hit the proper 2.5% GDP spent on healthcare by government. Okay, that has been in discuss since 25 years now, I guess. So still we do not have that. There is a lots of bed scarcity since we are not spending that much money on healthcare. So there is a lots of bed scarcity. There is a lot of medicine scarcity. There is a lot of hospital scarcity. Hospital scarcity. So what's your take on hospital bed scarcity, Kuntal?
Yes, we require 0.5 million beds to reach a target of 500 beds per million population. Okay, this is not. I'm not saying that 500 beds are for 500 beds for 10 lakh population is good enough. But if we want to go at subpar with the BRICS nation, then we need to add 500. We need to have additional 0.5 million beds to reach a target of 500 beds per million population. Okay, so there is a lot of bed scarcity in India, and suppose a patient in primary healthcare center is being referred to higher center for tertiary care, and the people are not getting bed. Okay, so this is a big issue. Okay, so apart from bed apart from bed scarcity, we have other problems as well. What are the problems, Supravo, you think are there apart from bed scarcity?
See, there are major problems according to. There is some vested interest. Since there is bed scarcity, there are some vested interest, and there are some, let's say, throwing out the responsibility on each other's shoulder. The primary healthcare would blame the secondary healthcare. Secondary healthcare would throw the blame the tertiary healthcare, and there's a big chain. Instead of it becoming a chain of a hierarchy of healthcare sector, it is becoming a hierarchy of let's say throwing the blame to on another. So there is some vested interest too because the bed scarcity is less. So as you all know, there are some four major pillars of healthcare. Like there is availability problem, there is this thing affordability, accessibility, and acceptability problem. Like, so let me repeat it again. There is availability problem, affordability, accessibility, and acceptability problems. So
Okay,
these are the areas.
so availability, yes, we need to discuss on these areas. So I'll first tell about acceptability. Okay, the the quality of healthcare that is being delivered in India by the government sector is not at all acceptable. Okay, people are people from our population are preferring private hospitals. They are not preferring government hospitals because the level of quality of the treatment that is being given in the private hospitals is much better than the government hospitals. So people are preferring private hospitals. So there is a big issue of acceptability of government hospitals. Okay, and then we have this affordability. Healthcare in India is not affordable. Quality healthcare in India is not affordable, and the people of India are very poor. Okay, so they are below. Most of the people. There are a lot of people who are below poverty line, and they cannot afford healthcare. Okay, so there is a big affordability problem. Also, there is a problem of lack of insurance of the people. Okay, and there is also accessibility problem. Okay, so we have most of the hospitals in urban areas. Okay, uh, from the urban areas, from the rural areas, people have to travel a lot of distance to get accessibility to good healthcare. Okay, so suppose there is a medical emergency, the person living in a village will have to travel a lot of distance to get good quality healthcare, and in between lot of people are dying. Okay, so it is also, accessibility is also a problem. Availability is there, but we'll discuss about it later on. Okay, so so tell us about the organization of healthcare in India, Suprabhu. How the how the healthcare is organized in India? What is the level of hierarchy of organization of healthcare in India?
I mean, as of now, see, the idea was we have to take healthcare from the grassroots level. We have to build healthcare from the grassroots level. So basically, we have at the primary level, at the secondary level, and there is also tertiary level, right? So it would be better if you just tell us about the primary sector and secondary sector in detail. Primary sector, secondary sector, and tertiary sector in detail. I mean, what comprises
So
those areas?
okay, in primary care we have these sub centers. Okay, these sub centers are catering to 5,000 people of villages. Okay, so they do not have a rigid requirement to have a doctor in a sub center. So the treatment that we get in a sub center is not at all good. Okay, then we have these primary healthcare centers where there is a mandate that you have to have a doctor in a primary healthcare setup. Okay, so in these PHCs we have doctors, but they are only MBBS doctors. There is also some specialist doctors, but specialist doctors are not preferring to go to primary healthcare centers. Okay, they prefer to stay in urban areas. So PHCs are in village areas. So people are not preferring, these consultant doctors are not preferring to go to the PHCs. Okay, and we have only, in most PHCs we have only availability of MBBS doctors.
Okay,
and these are new pass outs, and they sometimes they face problem, and it is not their lack of skill or anything, it is because of lack of experience. Okay, and I'll not blame them, but if consultants are not willing to go and these doctors are doing their job in PHCs, it is good, I will say. And then we have secondary care centers, and the secondary care centers have comprises of community health centers, sub-divisional hospitals, district level hospitals, mobile medical units, etc. Okay, and here what we face is, in the secondary care center we have shortage of infrastructure. Okay, they do not have CT scan machines, MRI machines. Okay, and there is also a lack of skilled workforce. Okay, and there is also a concern of quality healthcare there. Okay, a person who is going to a secondary healthcare center will always prefer to go in a private setup. Okay, and in tertiary healthcare centers we have medical colleges, ESI hospitals, urban health points. Okay, and in tertiary care centers, what problems we face, we do not have good infrastructure there. In government tertiary care centers we do not have good infrastructure, and also people prefer tertiary care centers. Okay, and in private sectors what we face is rising cost of treatment, and which is not affordable to the poor people of India. Okay, so Suprabhu, tell us more about it.
so basically, what I think is you're saying that primary sector is comprising mostly of, I mean, there is not actually a doctor. In secondary and tertiary level, we have to have a doctor. I mean, somebody who has gone to medical school for some of his golden years, right? So in primary and secondary and tertiary care, there is
No, in PHCs we have to have doctor. In PHCs we have to have doctor. In
okay.
sub centers we need not have doctor, but in PHCs we need to have doctors. Okay.
Okay. So there is and as you said, there are some. I mean, most of the people in for tertiary care, on the other hand, since the government hospitals quality is not that great, they prefer to go to private hospitals. And some of these people, I mean, who are really poor, they spend their lifetimes of earning in only healthcare. So there is a huge funding problem here. I mean, as we all know that we as India, we Indian, I mean, not only this is not only a problem of India. The funding, the healthcare funding is basically comprising of private funding and public funding, right? And in private funding, there is directly out of pocket. I mean, the cash payment. There is private insurance. There is other like say NGOs and other sources. And in public funding, there is pre-public healthcare services, and there is insurance too, like public insurance. Like there is state health insurances, and there is the ESI and all the other kinds of let's say insurances. So we, as of now, we have a big funding issue here, and there is a huge problem of insurance here too. I mean, we have to delve deeper into the idea of insurance. We have to get more people insured. I mean, we have to give more people health insurance. I don't know how to do that. We have to do that through banking or some other way. I don't know as of now, but we have to delve deeper into the insurance. Do you have any idea about the healthcare insurance that is currently going on, or on the other aspects of the healthcare?
Yes. So we have a very low penetration of insurance, and if we look at the total healthcare spending, only 5% is coming from 5% of that is coming from the insurance. Okay, and there is lack of knowledge among people about insurance. Okay, and this insurance provided by the private sector is not at all affordable. Okay, people are not willing to spend 30,000-40,000 rupees yearly to get insured for a disease that they are not expecting to have. Okay, so they are not getting insured. Okay, and most of the money, the major chunk of money that is being spent on healthcare comes from out of pocket, and it consists of 60% of the overall share of the healthcare spending. Okay, and if we look at the public and the private spending, then the public money that is being spent on healthcare is only 1/3. Okay, and 2/3 of the money comes from out of the pocket, or we can say that it is private spending. Okay, and from that out of the from the private spending, what I would like to tell is that only 5% of the total money comes from insurance. Okay, and that is quite less, and uh, people should be more
Aware about
people should get more accessibility. People should get more accessibility to insurance, and people should be aware that insurances are available, and the the premium that is being asked by the private players are also very high, and that premium should be decreased. Okay, so that people can
so
buy insurance at very low cost. Yes, yes,
you're saying the government, if the government should step in and then they somehow try to make the insurance cheaper, since there will be more people coming in. So the insurance premium could be cheaper. If there is more people coming, the insurance premium could be cheaper. I mean, what are the odds that all of the people are getting sick together, right? So we understand that, and as we are saying, there is a huge problem of affordability. There is affordability in cases of medicine too, right? I mean, in cases of medicine, what we are seeing, there is a recent trend that medicine, the cost of medicine is going down because of the government introducing generic medicine. Now, here is a problem. We have to think about that. Like on one hand, the cost of medicine is going down, so that is good for the common people. But on the other hand, that reduces the private companies incentives to fund new kinds of medicine, new kinds of drugs, so that new kinds of let's say we can handle new kinds of situations, we can handle new kinds of diseases. But since the pharmaceutical industry is becoming less profitable, so there are not major drug testing being done, right?
yes. What you are trying to say, Supravo, is about R&D. These days, the Indian pharmaceutical companies are spending very much less as compared to other foreign companies, foreign players on R&D. Okay, research and development, that is, and they are only manufacturing medicine and trying to sell those medicine, and also new drugs that are being invented in other countries. They are not also these countries are not all these companies abroad are not also willing to take these medicines in India. Okay, because they think that Indian market is not at all profitable. Okay, and at the same time, what government is trying to do is they are trying to sell generic medicine at low prices for the people, and this is good. I will say this is good if they can manufacture good quality medicines. I will not say bad quality medicine, good quality medicine at affordable price, which is at subpar with the branded companies. The efficacy of the medicine should be at subpar with the branded companies. Then only I will say that these medicines can be good and it can reduce the cost of the overall medication. Okay, so it is good actually. The step taken by the government is good, I will say.
Okay. So, okay, so this is somewhere, I mean, I understood that. And there are major shortages, as we are saying that there are shortages in everything, right? There is shortage in bed and there is shortage in, let's say, I mean, doctors, the major players in the healthcare game, the doctor, there are shortages of doctor. I mean, what's your take on this? I mean, how can we solve the problems of more doctors? As we all know, India do not have enough doctors as of now.
Yes. In India, we have one doctor per 1,700 population. Okay. What WHO suggests we should have one doctor per 1,000 populations. Okay. So we should have more medical institutions. Okay. So what regulatory bodies should do is they should decrease the regulation. Okay. To open a college now, there is a lot of regulation and there is a lot of hurdle that one has to go to open a medical institute. Okay. And they have to spend a lot of capital for opening a medical institute. But I don't think that a lot of capital should be a requirement to open a medical institute. A running hospital and with some good good amount of rooms for classes is enough to build a good medical college. Okay. So what India should do is they should try to decrease the regulation for medical opening a medical college. Okay. And also there is this geographical imbalance of doctor. See, we have a lot of doctors in South India because we have all these medical colleges in South India. Okay. And in North India as well as Northeast India, we have lack of doctors. Okay. So there is a geographical imbalance and a mismatch of the medical institutes. Okay. And there is also a concern on the of quality of the doctors that are being produced by these institutes. Okay. So what I will suggest we should try to bring down the regulation so that anyone who is trying to open a medical college can do it.
Okay.
Okay. To decrease the shortage of doctors.
Okay. So as we all know, we are going through a corona pandemic as of now. So it is a communicable disease, right? It is a hugely communicable disease, a huge, let's say, it is a social problem. It is a healthcare problem. It is an economic problem too, right? I mean, not as much of a social problem, but this is a huge communicable disease. So, are there any, I mean, communicable disease and everything that we should be aware of in national health? Like I was reading that in all these years, we are still not able to get rid of malaria, dengue, these kinds of basic diseases, right? So, there are major problems in communicable disease. So, what's your take on this?
Yes, there are a lot of communicable diseases, but what we need to focus is on non-communicable diseases because the non-communicable diseases leads to 60% of the mortality and morbidity. Okay. So, and for rest of the 40% is about communicable diseases. Okay. So I'll suggest we should focus today on communicable diseases, this non-communicable diseases. Okay.
Right.
Because
I mean,
this non-communicable diseases accounts for 60% of mortality and morbidity. Okay. So our major healthcare chunk is going on this non-communicable diseases. Okay. So we should talk more about non-communicable diseases instead of talking about communicable diseases because spreading of non-communicable diseases will be there and it will be very tough to contain that spreading. Okay. And we can these non-communicable diseases are preventable. Okay. We have hypertension, we have type 2 diabetes mellitus, and this diseases can be prevented. Okay. Many people are there, you will see there in on street are there who are smoking. Okay. All right. So they will have cardiovascular diseases and they will have hypertension, they will have stroke. Okay. They will have heart diseases. Okay. So these things are preventable. If they stop smoking, they can these diseases can be prevented. Okay. So we should talk more about non-communicable diseases, I guess.
okay.
More about non-communicable diseases.
Basically, I mean, these kinds of diseases are totally preventable and curable. Like, if we stop these kinds of habits at early stage, right? Because some of these are
Yes,
habits.
no, not curable. Once you have it, you will have it for whole of your life.
Yes.
These diseases are not prevent. They can be prevented by lifestyle changes. Okay,
exactly, early
because
stage
most
lifestyle
of the chunk of our healthcare,
changes.
most of the amount that we are spending on healthcare is because of this non-communicable diseases. So we should focus more on this non-communicable diseases. Okay. Also, there is also a problem of quality of healthcare. Okay.
Mhm.
Okay. India accounts for 40% of the unsafe patient practices worldwide. Okay. Out of the total unsafe medical procedures as well as practices, India accounts for 40% of that. Okay. Can you imagine, Supro, that 40% of the total unsafe patient practices are being done in India?
So huge medical negligence.
Not negligence, I will say.
Mm-hmm.
Unsafe practices, let's say like that.
All right, all right.
Let's say that there is some medication error. The doctor says something and nurse does something else because of communication gap. Okay, so there is a huge problem of quality in healthcare in India. Okay, and we have only 22 JCI accredited hospitals all over India. That is Joint Commission International. Okay, that is a hallmark of quality worldwide. Okay, and we have only 22 hospitals which are JCI accredited, and we have almost like 300 NABH accredited hospitals. Okay, these hospitals are getting these NABH accredited hospitals are getting accreditation, but after getting accreditation, they are not maintaining the quality. I think because after getting the accreditation, what they are doing, they are trying to reduce the cost of operating the hospital. Okay, so when they are following and they are using the NABH tag for marketing purpose, but they are not following the protocols because it is increasing their operating cost. Okay, so some hospitals after gaining the NABH accreditation, what they do is for decreasing the operation cost, they do not follow the protocols. Okay, and I don't think the quality of the healthcare being provided by these hospitals is at par. Okay, so what's your take, Supro, on quality?
So basically, what you're saying that these things are nothing but what once was effective tool to assess the quality of healthcare, it is nothing but a marketing gimmick nowadays. I mean, not as per gimmick, but so it is being mismanaged. The idea of NABH accreditation is being totally misused by some of the hospitals. I'm not saying that most of the hospitals, but some of the hospitals. And also there are certain issues that we always hear that the quality of healthcare in government hospital is not that great. It is because of the government hospital is not even functioning properly. There is always some quantity issue, qualitative issue. So I think government hospitals should also get some sort of NABH accreditation. I mean, if we take the government hospital and push that up to the NABH accreditation level, NABH accreditation, I mean, to that level, that when it could be NABH accredited, and then we maintain that, because government in future is going to spend much more. So we are increasing the budget and everything. So the government hospital will also be NABH accredited, and the private hospital will also be NABH accredited. So the quality of healthcare as a whole would also increase, right? So
Yes.
with this thing,
Yes.
what I would say, I mean, as of now we are running out of time. It is late already. So what we are saying is there is this new healthcare policy that launched in 2017, as of I remember. The idea is pretty much simple: make healthcare affordable for everyone. But we all know that the healthcare should be promotive to all segments, okay? All segments of the society, and there should be preventive and curative treatment. All right, and we hope to see a happy and healthy India. That is our motto, and we should work on these things, and we should discuss about these things more in our next episode. We'll talk about the national health policy in detail. So as of now, it was really nice talking to you. So thank you.
Thank you, Supravo.